আমাদের এখনকার লেকচারের বিষয়বস্তু হলো Pseudomonas. Pseudomonas is the most important cause of hospital-acquired infection. Its main targets are immunocompromised individuals. Healthy individuals এর সাধারণত Pseudomonas কোনো ইনফেকশন করতে পারে না। এজন্য যে সমস্ত রোগীরা বার্ন অথবা যারা ভেন্টিলেটরে থাকে, বার্ন ভিকটিমস, individuals on ventilators or catheters, এরাই হলো Pseudomonasের মেইন টার্গেট, কিংবা যারা সাইটোটক্সিক ড্রাগস পায়। That means immunocompromised individuals, either local or systemic immunocompromised. Infection can occur at any site and can lead to urinary tract infection, sepsis, pneumonia, and a lots of problems. Their bacteriological properties, they are obligate aerobe. This is the most important property. Most of the gram-negative bacteria are facultative anaerobe, but they are obligate aerobe. They are motile and oxidase positive. This is another important. Enterobacteriaceae are oxidase negative, but these are oxidase positive. So these 2 points, obligate aerobe and oxidase positive, these 2 points you must remember. They are clinically important because they are resistant to most antibiotics except the anti-pseudomonal antibiotics. They are widely distributed in soil and water and the human gut, and they can grow in distilled water, even in antiseptic solution. They produce a capsule or film layer that resists phagocytosis. There are many species of Pseudomonas, of which for you, for nursing students, if you remember only Pseudomonas aeruginosa, that will be enough for you. So again, is an opportunistic pathogen, never infects uncompromised or immunocompetent host, and can infect any tissue in the body. They can grow even at 42 degrees Celsius and also at 37 degrees centigrade. They produce two pigments, one bluish and one greenish, that gives a special appearance in the colony appearance, and characteristic fruity water helps in identification. This is the colony color due to pigment. They are the most frequently isolated non-fermenter in the laboratory. List of the diseases produced by Pseudomonas aeruginosa. There is a big list in one sentence. Any tissue of the body can be infected by Pseudomonas aeruginosa if the host is immunocompromised, either locally or systematically. So, as I have said before, it can cause infection in the burn patient, in the catheterized patient, and in the patient with ventilator. So the list is this big list: air infection, including external air infection, skin and soft tissue infection, respiratory tract infection, bacteremia, endocarditis, central nervous system infection, eye infection, bone and joint infection, urinary tract infection, wound infection, and so many. So many diseases they produce. So how many virulence factors they have? They have got many virulence factors. Adhesin by the fimbria and the flagella. Invasin by they have got enzymes. Motility by flagella. They have two important toxins, exotoxin A and exoenzyme S, or also known as exotoxin S. Exotoxin A is similar to diphtheria toxin. They have got as a gram-negative bacteria, lipopolysaccharide, and they have got capsules, so they have got anti-phagocytic properties and ecologic criteria, because they need they have minimum growth requirement, and they can grow even in distilled water. distilled water. So these are the virulence factors. Just you remember the names. Their diagnosis similar to all other bacteriological disease. This is culture, microscopy, and biochemical test for identification. So study questions. What is the clinical importance of Pseudomonas? Pseudomonas is a bacteria that is most important cause of nosocomial or health care associated infection in the patients with burn, catheter, or ventilator. And they also cause infection in cystic fibrosis patient. Can Pseudomonas cause infection in healthy individuals? The answer is no. What are the virulence factors? I have shown you the list. What is the mechanism of action of exotoxinase? Like a diphtheria toxin, that is, it acts by inhibition of protein synthesis. Disease, there is a big list. You will just memorize the list. How Pseudomonas differs from Enterobacteriaceae? Enterobacteriaceae are oxidase negative. Pseudomonas oxidase positive. Enterobacteriaceae are facultative anaerobe. Pseudomonas obligate aerobe. Enterobacteriaceae may be motile or non-motile. If motile, by peritrichous flagella, but Pseudomonas are motile by lophotrichous or amphitrichous flagella. These are the main differences from Enterobacteriaceae. So thank you very much.